هون common flu symptoms: fever, coughing, كحة, sore throat, runny or stuffed nose, يعني ممكن مسكر أو كتير منهمل, أوجاع, صداع, fatigue, tiredness, تعب. كلهم هدول بيجوا فجأة، وبالتالي هاي هي الأعراض الفلو.
Cold versus flu. Know the difference. Telling the difference between a cold and the flu can be difficult because they share many of the same symptoms. There are some key differences between the two you should know about so you can treat your symptoms properly and get better. What is it? A cold is usually milder, while the flu can be more intense. A cold rarely leads to serious health issues, but the flu can have very serious complications. That's why it's important to see a doctor if you're experiencing any of the symptoms listed below. Only special tests can determine if you have the flu. Understanding cold symptoms. With a cold, symptoms develop gradually. A fever is rare. There are slight body aches. Headache may occur, but is less common. A stuffy nose is common. A sore throat is common. With a cold, there can be a hacking cough that brings up mucus. Chest congestion is common, but usually mild to moderate. Understanding flu symptoms. With the flu, symptoms develop rapidly. There's a sudden onset. A fever is common. Body aches are common, affects the entire body, and are often severe. Headache is common. A stuffy nose is less common. A sore throat is less common. With the flu, there can be a dry, tickly, unproductive cough. Chest congestion is common and often severe. So even though there are distinctive differences between cold and flu symptoms, many can be subtle. That's why it's important to understand the differences so you can recognize your symptoms and take the right approach to treating a cold or the flu.
It begins with a tingle in your throat or a single sneeze, followed by a headache, drowsiness, a runny nose, and nagging cough. It's official. No matter how quickly you chug that glass of orange juice or lather on excessive amounts of hand sanitizer, you've caught a virus. Now the question is it the constantly mutating influenza virus known as the flu, or is it one of the 200 strains of the common cold? Because yes, there is a difference. While both attack your respiratory tract, the cold tends to stay up in the nose and sinus area, whereas the flu can enter deep into the lungs and cause complications, especially for young children, people over 65, pregnant women, and individuals with long-term medical conditions and weaker immune systems. Cold symptoms are much milder and more common, hence common cold. And the most common of common colds, the rhinovirus. On average, adults get 2 to 3 colds a year. It's one of the leading causes of missed days of work and costs close to $25 billion annually in lost productivity in the US. Unlike the flu, which has a specific season between October and May in the Northern Hemisphere, the cold can hit at any time of the year, but is also more common in the winter months. But contrary to popular belief, you can't actually catch a cold in the cold. You're more likely to catch one here, inside a closed space where viruses are constantly circulating. The reason we get sick more in the winter is simply because we herd together indoors, the windows are shut, and we're more likely to breathe the same air as someone who already has a virus. Whether it be a cold or a flu, the way the virus enters your body is the same. Take this scenario for example. John Doe is sitting on the bus while battling a viral infection, and here comes the sneeze. Before he has time to cover his mouth, projectile containing nearly 40,000 tiny virus-filled droplets are expelled into the air. Those particles can fly up to 2 meters, making anyone nearby a target, including unsuspecting Jane. The pathogen enters the lining of Jane's respiratory tract and uses its protein spikes like a key to enter a cell, hijacks the nucleus, and begins replicating even more viruses. Symptoms usually start within 1 to 3 days after being exposed to the virus. By now, Jane already spread her germs to her partner at home, and they've both taken their viruses to work, contaminating different surfaces, which then spread to their co-workers. And that's one of the fastest ways we spread germs.
It can survive on surfaces for at least up to a day and on skin for an hour. So you might shake hands with someone or touch a doorknob, and then afterwards if you touch your eyes or your mouth, then that's one way of infecting yourself.
On average, humans touch their face 3 to 5 times every minute without even realizing it. Most of the time, your body is strong enough to fight off infection pretty quickly.
We have antibodies that are created that will neutralize the virus in the nasal passages. And when that happens, eventually after a few days, the virus becomes inactivated, neutralized, and then the body can heal.
Generally, colds clear up within a week to 10 days, but the post-viral nagging cough can linger for weeks till it eventually resolves on its own. In the meantime, another cold virus could be lurking just around the corner. Influenza could last up to 3 weeks. The virus spreads rapidly, causing your body to respond more aggressively. One of the biggest differences between the cold and the flu is that the flu usually comes with a fever, and symptoms like that have less to do with the actual virus and more to do with the immune response. Over-the-counter medications like acetaminophen and ibuprofen can help control those symptoms. Antibiotics, on the other hand, treat bacteria, infections like bacterial pneumonia and strep throat. It will not help you when you have the flu or cold and will in fact do more harm than good. So what can you do to protect yourself from getting sick? Your immune system's great memory will in part help you with that. Every time a virus is destroyed, B and T cells remember that particular strain so it can react faster the next time. And that's similar to how the flu vaccine works. An inactive virus is injected into your system, just enough to trigger cells into action. Health officials say it's the no-brainer defense against the flu.
So if everyone in
Okay, how to treat or to manage a cold myself. أول شيء الراحة من أهم العناصر اللي بتخلينا نتخلص من الكومن كولد أسرع، لأنه بصير مناعة الجسم أفضل طالما أنا ارتحت ونمت أكتر. حتى الجسم بيكون تعبان كتير، فعشان هيك أفضل إني أنا أرتاح. كيب وارم، إني أدفي نفسي، ما أعرضش نفسي لانخفاض في درجة الحرارة في الانفايرمنت اللي أنا قاعدة فيها. بلنتي اوف ووتر، بصراحة هذا جزء يعني mainstay أو key element في علاج الكومن كولد. مين بيعرفها؟ اللي فعليا عمل هيك، اللي عمل هايدريشن لجسمه بشكل كبير في هاي الفترة، بيلاحظ على طول إنه بلش يتحسن في فترة قصيرة، من فروت جوس، من مي. المي لوحدها كافية، بس أغلب الناس بتحب إنه تاخد حمضيات في هاي الفترة، يكون بكميات كبيرة سواء بالشرب أو بالأكل. هذا من الأشياء اللي مهمة to avoid dehydration. gargling with salt water، يعني أتخلص من هاي الفيروسات بشكل كبير في المنطقة، وتطهيرها بشوية مي وملح كويس. أكيد بدي أتابع كل السيمتومز اللي بتظهر معي عشان أتخلص منها بهاي الطريقة. إنه منها مثلا ارتفاع درجة الحرارة، الكافينج. طبعا بقدر بارتفاع درجة الحرارة بتخلص منه بالبارستامول، استامينوفين. ممكن other painkillers such as ibuprofen، خاصة لما بيكون في عنا aching في العظام، يعني تحس ألم في العظام، ممكن ناخذ الايبوبروفين. طبعا الانسيدز ان جنرال لازم اهم شيء ناخذهم على معده مليانه عشان to avoid gastric or GI irritation. فيتامين سي فيتامين سي من الاشياء اللي ممكن ناخذها لرفع المناعه. الإكينيشيا معروف عنها، هي نبات موجود منها على شكل أدوية، يعني مستخلصات موجودة في السوق. طبعا أنا اللي عندي منها لديلاس اسمها أكتيفلو، عشبة معروف عنها إنها بترفع مناعة الجسم، وبالتالي بياخدوها عادة في حالات الفلو. جارليك، توم، من المواد المعروف عنها إنها has antibacterial وإفكت وبترفع المناعة بشكل كبير. أوكي، زي ما قلنا drink plenty of fluids, rest, inhale steam from a hot shower أو vaporizer or kettle. هذا من الأشياء اللي بتعمل humidification أو ترطيب للسور ثروت، وبالتالي بيخفف من الانزعاج عند المريض. أكيد avoid smoking. sometimes خاصة الناس متعودين تعمل exercises من الأشياء اللي بتنشط الجسم، وبالتالي بناخد ريست فترة منيحة وبعدين ممكن نعمل بعض الإكسرسايزز بدون إجهاد. Over-counter medications أو OTC medications include gargles, lozenges, cough syrups وكمان في عندنا decongestants. acetaminophen to relieve symptoms. الكف سيرب حسب الكفينج إذا كان producing sputum معناته I need يعني اللي هم الإكسبكتورانتس. لكن إذا كانت الكف dry معناته I need antitussive or cough suppressants. الديكونجستنتس عادة بنستخدمهم للتخلص من الكونجستشن in the nose. أوكي، عادة إذا كان في عندي dry cough نستخدم الدextromethorphan which is an antitussive. otherwise ممكن نستخدم الجوايفنسن أو الإكسبكتورانتس اللي فيهم الجواي أو الكف syrups containing الجوايفنسن which loosen الميوكس. ممكن يكون كمان في عندي antihistamines خاصة إذا في sneezing متواصل أو انهمال في العين أو احمرار في الأنف أو غيره. كل هاي الألرجي ممكن نتخلص منها بالأنتيهستامينز. ممكن نستخدم nasal sprays بس المفروض إنه ما نستخدمهم مش أكتر من 3 أيام لأنه بصير في عندي rebound congestion. أوكي، other measures ممكن تساعد اللي هي hot liquids أو اللي بسموهم hot herbal tea، ويفضل إنه نضيف لهم عادة ملعقة من العسل لأنه هاي من الأمور اللي بترفع المناعة. طبعا المنثوليتد سالف اللي هو إحنا بنشوفه الإصبع المنثول من الأشياء اللي ممكن إنه نتخلص من الستافي نوز بطريقة سهلة. بتكون عادة فيها المنثول، يوكاليبتوس، كامفور، كلها من المواد اللي بتفتح المجاري التنفسية. Sometimes we need hot packs on our sinuses خاصة إذا حسينا إنه الجيوب فيها stuffed. فبهاي الطريقة إني أنا ممكن أتخلص من الوجع أو الساينوسايت، مش الساينوسايتس، هي الألم اللي أنا حاسه في الساينسز أو الستافينج. يعني أنا حاسس إنها مسكرة، إنها يعني مزعجاني. ممكن إنه to put another pillow under my head خاصة في فترة السليب، إني أنا أنام على مخدة زيادة من الأشياء اللي ممكن إنها تساعدني بشكل كبير. طبعا الإكنيشيا أنا بدي أورجيكم إياها للي ما بيعرفها. كده أخذته عنها بالفارماكولوجي. هاي الإكنيشيا اللي هي كوني فلاور، معروف عنها إنها immunity boosting flower. هدول most common decongestants available اللي هم الإفدرين، أوكسيميتازولين، زايلوميتازولين، فينيلإفرين، سودوإفدرين، إبراتروبيوم بروميد. These decongestants, some of them may affect الهارت. حتى مرات بعض الأشخاص ما بيكون في عندهم مشاكل في القلب، لكن لما بياخدوا مثلا سودوإفدرين بيعملهم بالبيتيشن. عشان هيك هذا من الأشياء اللي إحنا ممكن نتجنبها، نروح على less causing لهاي الإفكتس such as phenylephrine.
Decongestions work by constricting the blood vessels inside your nose, and that will reduce the congestion. They're most commonly used in things like colds, where clearly there's lots of inflammation going on, but they can sometimes be helpful, for instance, in sinusitis or in hay fever. Children under 6 should never use decongestants, and if you're pregnant or age 6 to 12, they should only be used with specific advice from a pharmacist or a GP. What's more, you should never use them for more than about 7 days, less than that if possible, because if you do use them for longer than that, then you can get what's called a rebound. Things can become worse than they were in the first place when you stop using them. There are also certain people who should be careful about using them. For instance, people with medical conditions like very high blood pressure or overactive thyroid. If in doubt, ask your pharmacist.
Of a range of naturopathic preventatives and remedies for colds. Honey and oil of oregano are said to have antimicrobial properties. Herbs like cinnamon and ginger increase circulation, which help boost the immune system. Then there's garlic.
Garlic on its own has been shown to be really great for immune system. So you can even chop some of that up and put it in your tea when you're having your warming teas, 2 to 3 times a day. Having that raw garlic can definitely help boost your immune system.
What actually works depends on who you talk to.
Orange juice, I guess. Vitamin C.
Cold effects.
Chicken soup always works very, very well.
عم يحكوا عن الجارليك لرفع المناعة في حالات
Evidence on things like echinacea and
في
golden
حالات
seal is
الفلو.
anecdotal, but do agree nasal rinses will shorten the length of a cold, and that zinc helps too.
The zinc actually binds to the viral particles, and so it helps prevent replication. So you won't get as many viral particles causing the...
Okay. Patients of diabetes, glaucoma, heart conditions, high blood pressure, prostate problems, and thyroid problems should report to their physician. طبعا أكيد decongestants ما بنعطيهمش ل younger than age of 6. Okay, decongestants might interfere with diet pills, medicines of asthma and medicines for high blood pressure. فعشان هيك هدول البيشنتس كمان لازم ياخدوا حذرهم إذا بدهم ياخدوا. Okay.
Let us take a few seconds to review the pathophysiology of sinonasal conditions. This is vital for correct management and effective treatment.
هذا هيك الطبيعي داخل الساينسز. شوي.
If we look at these inflamed sinuses and the respiratory mucosa, we will see that the body's main defense system in such situations, the mucociliary system, is unable to move the mucus outwards. The mucosa becomes increasingly edematous and the inflammation gradually blocks mucus outflow. The sinus becomes blocked with secretions that in time will become mucopurulent. We'll describe an acute rhinosinusitis with symptoms of nasal obstruction or congestion, or anterior or posterior rhinorrhea, with varying degrees of facial pain or headache, or even loss of smell, depending on the severity of the rhinosinusitis. Let us see what happens when we spray Nasadrin once a day in each nostril. A few seconds after contact with the respiratory mucosa, an abundant secretion is observed from both the goblet cells and the submucous glands in the mucosa. Or perpetuate the lesion.
Receptor agonists, which on topical application in solutions of 0.05 to 0.1% produce local vasoconstriction. The imidazoline compounds like nafazoline, zymetaboline, oxymetazoline are relatively selective. Alpha-2 agonists, which are also used as nasal decongestants. They have 12 hours of duration of action, which is longer than ephedrine. They may cause initial stinging sensation. So regular use should be avoided because mucosal secretion is impaired by these categories of drugs, and atrophic rhinitis and anosmia can occur due to persistent local vasoconstriction. This is vasoconstriction, especially in the mucosa and the skin, but it has fewer CNS and CVS effects. Orally used at the upper respiratory tract, it acts on nose and eustachian tube. It is combined with antihistaminics, mucolytics, antitussives, and analgesic agents in therapy. Phenyl propanol